Now we talk about this is a UQ, a university question as well. The nervous innervation of the bladder. Um the urinary bladder is unique in the sense that the control involves both involuntary autonomic nervous system reflexes, mainly parasympathetic, and on top of it, it has voluntary control as well, as we all know. Children don't have it, infants don't have it, and they develop when they are being potty trained for the first 2 to 3 years. They keep wetting their diaper or their beddings because they don't have conscious control over their urination. But as they grow and the nerves are myelinated, they get control of their urination, and we will talk on we'll talk about this in this slide. So basically the control of maturation, the control of the bladder is a unique mix of autonomic, subconscious parasympathetic drive and voluntary control, which comes directly from cerebral cortex. So let's just dive in and let's pick up proceedings from the bladder upwards. Okay, so this is the bladder, and it's being supplied by mainly by the sacral cord, sacral segment of the spinal cord, and also the thoracolumbar cord. The nerves are not shown here. Uh, so basically, the sacral cord, if you refer to this slide, which is a basically a blown up part of this area. So this is the bladder, this is the sacral component, and you see parasympathetic fibers going into the bladder. This is the blue thing. They're going into the bladder. They're supplying the main bladder body. Then you have the same parasympathetic fibers going to the bladder neck, that the posterior urethra. So these are the parasympathetic fibers. Okay, they are part of the pelvic nerves, which go from spinal cord towards the bladder. Now, the same pelvic nerves also carry sensory fibers, sensory afferents from the bladder back to the spinal cord. So that's one thing to note. You see another. So that's so sorry. That's the sacral cord, and that is this segment of the control of the whole bladder thing. The parasympathetic nerve fibers arise from the sacral segment of the cord. Then you have the thoracolumbar side, extended from T11 to L2. And as you can see, if you can correlate this with this diagram, it's the lumbar section, basically, which supply the sympathetics to the bladder. And you see that it's quite an extensive supply of sympathetics to the fundal area, the main body of the urinary bladder, and also the trigone area near the neck of the bladder. This is an important point which I'll discuss just in a bit. So as we are going from bladder upwards, we spoke about the sacral segment. Parasympathetics should come into mind. Thoracolumbar segment, sympathetics should come into mind. Then we go up, and here we see that at the level of the brainstem, specifically the pons, you have a maturation center here, which we'll touch upon later. And then you have the highest area of the CNS, the cerebral cortex. This is where the conscious control of respiration comes from. This is how you hold the urination when you don't want to go, and when you do want to urinate. This is where you control it from. So this entire network of control over the bladder is basically under the purview of your conscious control in the cerebral cortex. Okay. Uh, uh, just finishing off this whole diagram, this is a good diagram to learn how to draw. It gives you the location of the parasympathetics and the sympathetics. So these are the two autonomic nervous component of the bladder. You will also notice that lower sacral segments, there is a nerve coming out called the pudendal nerve, and it's going to the external urethra. So external sphincter, I beg your pardon. So we studied the internal sphincter just a while back, and now we're talking about an external sphincter. This external sphincter is actually a proper sphincter. It's made up of skeletal muscles, which is interesting because skeletal muscles are under conscious control. And indeed, the pudendal nerve is a somatic nerve. So this is where you, i.e. the cerebral cortex, control the overall emptying and filling of the bladder by holding on to the external sphincter. So if you contract this sphincter, the bladder will not empty and will keep on filling. And it's when you consciously relax this, we call it, it's a learned reflex, which we'll touch upon later on. When you relax this skeletal muscle, this sphincter, then urine is allowed to come out. Okay, so this is an important point to note. You have sympathetics, you have parasympathetics, and you have somatic nerve, all innervating the bladder. And these are the three levels of the control. This is another way of looking at it. The spinal cord reflexes, which is this and this. Then you have the maturation pons area, which has a part to play in this, and the highest is the cortical and subcortical structures, basically in the forebrain. Now, what exactly is the role of the parasympathetic and the sympathetic nervous system? It's an important point, and has to be obviously mentioned when you get a question on nervous innervation. So very simply put, parasympathetics are basically uh, they contract the bladder. Okay, so they are motor in nature, and when they get stimulated, simply put, the bladder will contract and try to expel its urine out. Okay, so what do the sympathetics do? We will keep on mentioning the maturation reflex. Maturation reflex, very briefly at this point in the lecture, is these are reflex contractions which are incremental. So at low volumes, they are slight, they are less in their amplitude. But as the volume collects in the bladder, the maturation reflex contractions, they increase in amplitude. Okay, so this is going on in the background subconsciously. This maturation reflex, it's going on and on and on because the urine volume keeps on being added into the urinary bladder. So this is something that is at the backstage of the bladder functionality. Whether it will lead to a significant maturation reflex contraction, causing the person to feel the urge to now, go and urinate, that will depend on what the eventual volume of urine is and how aggressive these contractions are. Okay, so in that reflex, parasympathetics cause the contraction bit of the maturation reflex. Okay, more on this in a bit. Sympathetics don't have a part to play in the maturation reflex. Please make a note of this. Once again, sympathetics do not play a part in the micturition reflex, which is the mainstay of this lecture. So what do they do? A bullet point, there are two bullet points about it, two main headings. One is they have a role to play in the filling of the bladder. Okay, I'll explain it in a bit. First, I'm just giving you the outline. So sympathetics, their function is in the filling of the bladder, and second is closing off of the urine flow into the urethra when there is ejaculation. So seminal fluids together with sperms, when they are using the urethra, you don't want urine to come in or the seminal fluid to enter into the bladder. So this is where the very important function of sympathetics come in. They close off basically this area here. Basically, this is where they are rich in supply as well. They close off this area so that there is no urine input into the urethra during the act of ejaculation. So they seal it off, and that's the second most important function. Going back to the filling function, if you look at the way they are arranged, they are numerous clearly, all around the bladder body. Okay, and then you have the supply on the trigon. So at rest, and note this, that we're talking now at rest, because they don't play any part in micturition reflex, which is about contraction and it's about emptying the bladder. So there is no role in that. But at rest, when the bladder is filling, what it basically does is it basically relaxes the detrusor so that it could accommodate more volume, and it contracts the outlet of the bladder right here. Okay, so it will contract the bladder neck muscles, so that the tone of this internal sphincter is enhanced, and it shuts off any dribbling out of the urine. So the urine is basically trapped inside the bladder, and since its wall is being relaxed by the action of sympathetics at the same time, you have a pro-filling, quote unquote, effect in the bladder. So that's the function of the parasympathetic and the sympathetic nervous system in